In the midst of the troubled healthcare rollout, the president and Democrats have assured the American people that the law itself remains a good one. In fact, the law was passed based on that same promise and many, many others. But are they panning out?
If you've got health insurance, you like your doctor, you like your plan, you can keep your doctor, you can keep your plan. If you like your doctor or healthcare provider, you can keep them.
Everybody will have lower rates.
If you like your doctor, you will be able to keep your doctor, period. And this is for people who have health insurance. You will save money. If you like your health care plan, you will be able to keep your health care plan, period.
Obamacare has been wonderful for America.
If you like your health care plan, you can keep that too. If you like your doctor, you keep your doctor. If you like your current insurance, you keep that insurance, period. End of story. Now, the naysayers and the cynics still doubt that we can do this. No one will take it away, no matter what.
It was a promise at the heart of the sales pitch for Obamacare, and one many Americans doubted.
What makes you think the government could run a new health care program?
This is not a federal government issue. This is a people issue.
Leave us alone. That's all we would ask. Would you leave us alone?
4 years later, the naysayers are seeing some of their worst fears realized as hundreds of thousands receive letters canceling their health insurance or significantly hiking their premiums. And that number is expected to rise.
I was infuriated, totally infuriated. The president kept saying, you know, if you like your plan, you can keep your plan. Your premiums will be going down. But in fact, the letter is completely contradictory to that.
Deborah Cavallero says she got a letter from Anthem Blue Cross canceling her existing policy and offering her a new one that would hike her monthly payment from $292 to $484.
It's sort of forcing you to walk the plank.
And she is not alone. Andy and Amy Majoni of Louisville, Kentucky recently received a letter from their insurance agency, Humana, informing them that their monthly premium was going to triple from $333 to $965.
This is a high deductible plan where I'm assuming a lot of risk for my health insurance for my family. And nothing has changed. Our boys are healthy, they're young, my wife is healthy, I'm healthy. Nothing in our medical history has changed to warrant a tripling of the premium.
Why is this happening? Because Obamacare requires policies sold in the individual market to cover what the law deems essential services, like preventative care, rehab, and maternity services. Basically, it's no longer up to you to choose what's best for your family. The government has chosen for you, and the new policies come at a price. Some insurers are hiking their rates, others are bowing out of the individual insurance market altogether. In fact, an estimated 600,000 Americans have already seen their policies canceled. Florida Blue terminating 300,000 policies. Kaiser Permanente in California sending letters to over 150,000 customers, and the list goes on. An estimated 14 million people purchase their own coverage on the individual market because they don't get insurance through their jobs. That's why experts say millions could potentially lose their coverage despite the president's repeated promises. When confronted with the facts of cancellations and rate hikes, those defending the law have scrambled for explanations.
I don't remember saying that everybody in the country would have a lower premium.
There are certain types of crummy plans that are now going to be illegal.
They should have been allowed to keep their insurance at least until it expired and then buy the plans through the exchange. But I think that's the mix-up. There's a transition issue, and I know it's difficult for a lot of people. I'm sorry about that.
Affordable health care was never meant to be, if you've got insurance, now you're going to have to buy insurance that's more costly and not as good.
Okay.
That has to be fixed.
But so far, we've seen little appetite in Congress for any, quote, fix to Obamacare, which leaves open the question of whether the president can still live up to his promises.
It's going to bring down skyrocketing costs. It's going to save families' monies. It's going to save businesses' money, and it's going to save government money.